Well, good morning. It's great to be here with all of you, and I'm just so excited about being in this room among a group of friends and people that have been so passionate and driven to really move the needle forward on this public health problem. I'll just briefly tell you that, I come to this conversation not just as a trauma surgeon at the Johns Hopkins Hospital, but also as someone who's a survivor. And I know that there's a bunch of survivors in the room. And I was thinking this morning as I was listening to Director Dettelbach about he made the comment that these are not just numbers and statistics. And I think we have to think about that, right? These are individuals like Jamie, like Ethan, like Jackie, and like Dylan, right? That are part of the social fabric of our communities. And you're going to hear from Kevin Sowers, who's our health system CEO. Kevin and I are proud to be here among this group, but we're also committed at the local and state level to try to make communities safer as we reduce what we're seeing, which is the daily toll of gun violence in America that is disproportionately impacting communities of color. And I was thinking last night as I saw this painting at the MoMA by Gustav Klimt called Hope. And I was thinking about what we're seeing in this country. And it's easy to think about the fact that, we're continuing to see people being injured and killed, and it's easy to lose hope. But I think our country is so different than where we were 10 years ago, where because of people like yourselves that have been doing the hard work in cities and states across America, it has changed the temperature of the country, and it's led us to scenarios where we've passed the Bipartisan Safer Communities Act. And that's going to be part of the discussion that we have today, really focusing on intervention and prevention strategies on the ground. And I'm so excited that we have three tremendous panelists, and I'm going to let each of them introduce themselves. And we'll start with Sean Brown, the Executive Director of Youth Guidance.
Awesome. Thank you. Good morning, everyone. Sean Brown. I am the Executive Director of Youth Guidance Boston, where I have the fortunate pleasure to lead our two school-based counseling programs in Becoming a Man, BAM, and working on Womanhood WOW. Youth Guidance has been around for approximately 100 years. We work to create and implement school-based counseling programs that enable young people to overcome challenges that they face in life, succeed in school and life. Both BAM and WOW are strategically designed to create safe and student-centered supports that really promote academic and social-emotional development in the young people that we serve. And again, thank you. It is an honor and pleasure to be up here today, and I really look forward to sharing about the great work that we've been doing with both BAM and WOW. Thank you.
Thanks so much, Sean. The next is Nicole Hockley, co-founder and CEO of Sandy Hook Promise.
Hello, everyone. It's an honor to be here, and thank you so much to Northwell. I really appreciate this opportunity. I shouldn't be here. Let me get right down to it. But a little over 10 years ago, I put both of my boys on the bus to go to school. My third grader came home, and my first grader didn't. And Dylan was killed at the Sandy Hook school shooting in December 2012. And 10 years later, even though this is my life's mission, my job is still to put my organization out of business. And I think that's something that we all share here because our kids should be safe. Sorry about that. I'm not going to start over again. But our kids deserve to be safe wherever they are. So Sandy Hook Promise, what we do a lot of lobbying at the state and federal level and have been very successful in many of our efforts. But our core purpose is to teach youth how to recognize when someone else needs help, not only to practice inclusion and connectivity, but to recognize when someone needs help and then to get them the help that they need. We have a lot of data from over nearly 160,000 tips that have been reported from students across the country on at-risk behaviors and threats that they're seeing and observing, and how we've gotten those interventions, including last week our 14th school shooting plot that was averted. So proud to be here and share ideas and strategies with the amazing people that are here in the audience.
Thank you so much, Nicole. And definitely last but not least, Amy Solomon, the Principal Deputy Assistant Attorney General, who's here with us.
Too long. Thank you. Good morning, everyone. I'm really honored to be a part of this incredible panel, very inspiring panel, and glad to be here. I appreciate the frame of optimism that brings us all to the table today, and also having healthcare step up in such a big way for what has often been a public safety issue and is being recognized as a public health issue. I'm with the Office of Justice Programs. We are the Department of Justice primary grant-making organization. Every year we invest $4 to $5 billion in states and localities, everything from front-end prevention on the juvenile justice side to reentry after people who have been incarcerated. We work intensively to support victims' services, as well as we house the research and statistics functions for the Department of Justice. So I'm really grateful to be here and very cognizant of where you started us with how we can invest our resources to make sure that we can support community organizations and collaboratives on the ground to reduce gun violence.
Yeah, thanks so much, Amy. And why don't we get started with that? We'll go in reverse order. You know, the Bipartisan Safer Communities Act is, of course, providing historic funding for gun violence research, for CVI programming, and gun safety education. Can you tell us a little bit about, of course, the DOJ is intimately involved in programmatic efforts to distribute the funding. Can you tell us how you and your office are thinking about this funding as it begins to reach communities? And what are some of the opportunities, and perhaps what are some of the potential concerns that you have?
Yep, thank you. So the Office of Justice Programs, OJP, does have a role in implementing some parts of the Bipartisan Safer Communities Act, and I'm just going to touch on two of those. One is the community violence interventions, and we are so excited. These are new resources provided by the Bipartisan Safer Communities Act and appropriations. And this year, in September, we awarded $100 million, new dollars, to community-based organizations and to city-led collaboratives to invest in some of the highest risk people in their communities and getting them the resources that they need. This is 47 sites in the first cohort, as well as some research and evaluation projects. Some of these are seeding new efforts in cities. Some of them are expanding and scaling places that have already been started and are promising. We're also funding some intermediary organizations to provide microgrants to smaller CBOs that don't have the capacity to apply for federal funds and giving them TA to help. Our goal here, and kind of a little bit of the shift, is to seed and strengthen community infrastructure to be a complement to law enforcement and a real partner in the field. So we're excited about that. We just held our first national conference. We had over 400 people there in the room, and I think really feeling like this work is happening all over the country, but to begin to knit a stronger network together felt powerful and optimistic. And we will very soon, in the coming weeks, release this next year's solicitation, another $100 million, which will go to the field and also support research and evaluation. That was part one. I want to quickly touch on part two, which is the, we call it Burn Skip, the Burn State Crisis Intervention Program. I apologize. Our Bureau of Justice Assistance runs that. Our Principal Deputy, Krista Mahoney, is here in the room. And these funds, which were $150 million a year provided by the Bipartisan Safer Communities Act, are going to states to both develop and implement extreme risk protection order programs and to fund other kinds of crisis and court intervention programs. So about 2 weeks ago, over $230 million went to states to seed this work. They are each putting together councils that are interdisciplinary that will inform how those dollars are spent. And I'm so excited because today we're also developing and supporting new expertise that's going to be on the ground to help states implement these funds. So by sheer coincidence, we're funding Johns Hopkins, the Center for Gun Violence Solutions, at $2 million to stand up an IRPO, a National IRPO Resource Center, to be able to both inform the grantees and give them expertise and to inform the field. And we'll also be funding the National Council on Juvenile and Family Court judges to really train court personnel and judges in these areas, and the National Criminal Justice Association to help with data infrastructure and data collection. So we're really excited about getting real and new resources and expertise to the ground to help with these issues.
Yeah, that's just tremendous. And I would just say that, those of us that have been working in the space are so excited to see finally the real investment in communities and community organizations that have, I think, as Fatima said, those that are closest to the struggle often understand the solution. So thank you for that.
Yes.
Nicole, thoughts about that? Obviously, you have, an incredible organization. How do you envision kind of the bipartisan safer communities playing a role as we listen to all this, fund making? And of course, we're sitting here with a bunch of, healthcare executives and leaders across the nation. Can you tell us a little bit about your thoughts and how you envision it playing out?
Sure, thank you. And I'm, like everyone, very, very proud of the Bipartisan Safer Communities Act. It's one of the most significant pieces of gun safety legislation, school safety, mental health, community violence in 3 decades. So for those that say it didn't go far enough, yes, and look how far it's taken us already. So that's really important to remember. And funding is required. We've heard a lot today about data. We've heard a lot about community-based organizations, and we're going to hear more about that as well, and how much more need is there. And when I think about a lot of the healthcare professionals watching today and in the audience, and the CEOs of the hospitals that Michael talked about, 50 is awesome. There's more that's needed. So have a think about why you haven't signed that letter yet. What's holding you back? What fear? What barrier? Because there's a way through it. Anything is possible. But it takes us working together collectively. And when I think about, one of the earlier presentations, both from Dr. Zhao and others, we were talking about the need for connectivity. And I think about the programs that we offer at Sandy Hook Promise and what we do in terms of schools, school-based programs to help teach young people how to take action. And I think about all the information we get. We work with community-based organizations. We work with schools. We work with local law enforcement. The hospital sector is the key component missing from that equation. And when I think about, you are in a unique position that not only do you have to see the tragic after effects of firearm violence, you're seeing people before they get to that stage. And you're possibly seeing repeat people coming through, especially when we think about suicide by firearm. And when I think about young kids that might be going to the hospital because of an attempt or self-harm, they're on that escalation path. And is there a way to connect the data with community-based organizations, schools, and hospitals so that we can truly look after the whole child? I focus on schools primarily, but kids live in schools, homes, and communities, so we need to be looking at them holistically and helping keep them safest. So that's what I think about with our opportunities here.
Yeah, thanks so much, Nicole. Sean, your story always touches me, and I just am so glad to have you here with us today. And you're someone that, of course, we're talking about, funding programs, and we're talking about policy change and all these different systematic components. And you're, of course, working in that space, but you're also working on the ground. And I'm just wondering, can you share with us a little bit about, maybe you have a story or thoughts about the moment we're in and how we can utilize this space and these different opportunities to really impact the communities that are being decimated by gun violence on a daily basis?
Absolutely. Thank you. So a story I want to share first, I want to talk about the data around what makes BAM successful in the work that we do. I want to give a shout out to our friends at the Chicago Crime Lab. So Rosanna, I want to give you all a shout out. So for us, we've had 2 randomized control trials that really speaks to our impact for reducing violence and increasing graduation rates for young boys of color. Anyone who is familiar understands that RCT is a big deal. One, it opened us up to just vulnerability around being transparent around the work that we're doing and what that data could tell. So the research really followed approximately 2,700 young people from across Chicago, 18 schools in Chicago. And what that study found that BAM reduces violence by 50% for young people in our program, increase graduation rates by 20%, and reduce overall crime arrests by 35%. The study also showed for every dollar invested in the program, there's a $30 return just by keeping our young people out the system. That number is said to be higher if we start to look at the college going rates. So how does that impact in on the front lines, and what do we see with young men? When I think about the violence that's happening in our community. This year, we're at the double murders to gun violence in the city of Boston. And I think about the work that we do with our young men in the schools, creating that safe space for young men to have conversations and think about their actions before they go back out into the community and react. So just a simple step of teaching young men to slow down your thought process, realize where you are in the moment. Just a little bit about my personal story. I lost my brother to gang violence. My brother wasn't gang involved or anything, but caught in a crossfire between two rival gangs. I'm a lifelong resident of the city of Boston and a product of the Boston public school system. So for me, this work is really personal because growing up, I was told that I'd be two places, and that was dead or in jail. I think about if I had a program like BAM, where would I be today? I'm fortunate to be here as a leader and executive director of a national organization, but I think about the road less traveled that I would have taken to get here in this place. So truly fortunate to do this work. When I look at my young people, I see myself. Last night, I've cried more in the past, and I have to say this, in the past 6 years than I have in my entire life. And that's because of the work that we do at BAM. I love what BAM does for the young men, but I also love what it does for the men in this program. When I talked about losing my brother to gang violence, not having a father figure in my life, I never dealt with the trauma of that experience. And I didn't do that until 6 years ago when I joined this organization and started to lead this organization. I went back to that 10-year-old boy of my father not being in my life and having to deal with that and what was the impact and how it showed up in my life. I dealt with the death and murder of my brother. For years, I wore a mask, and I was ashamed to deal with that. My wife would say to me, "You should seek counseling." And I would say to my wife, "I don't need counseling. I'm not crazy." And I think about the program and opportunities that we provide our young men today with a program like BAM and giving that space, safe space, to be in front of a counselor, a youth specialist, who is that trusted adult. That speaks to the impact of our program. Is putting trusting adults in these young people's lives where they can have those safe and brave conversations. And I'll put a pin in it there.
Sean, wow. I mean, unfortunately, we're out of time, and I think we could continue this conversation on for hours. But what I'll say is that this was not the end. This is the beginning. And this was just really scratching the tip of the iceberg. We're going to have the breakout sessions later today where we're going to continue to peel back these layers. But I would just encourage each and every one of you that when you go back into your communities, each of you are leaders within your communities, and you have the ability to be part of that change. For far too long, the burden of this problem has really been placed on the shoulders of a few people. And it's time that we all kind of pick up the baton and be part of this process. And to be able to link, what's happening on the ground to what's happening at the national level and in communities, that is just so incredible. So thank you for being here, for sharing your stories, for being vulnerable with all of us. And thanks to Northwell for having the vision to bring us together.